Congress, and just to look at the number of people in this nation that are dying of drug overdoses is absolutely astonishing to me. I mean, when we look at the number of deaths, and I say Sergeant Major here, and Sergeant Major, I do remember when I was in the Army, it was when I was in the infantry years ago, the command structure sort of went this way. It was your commanding general was God up here first, of course, and then the commanding general and Sergeant Major, but not necessarily in that order, as I remember. And so, you know, we looked at, I looked at the CDC data on deaths, and we were talking about methamphetamine, obviously, and its transport and how you all professionals take care of it. But it's a much bigger issue than that. And when you look at prescription drugs, this past year the CDC reported that more people died of unintended overdose and deaths than died of car wrecks. And we've had very much success in the cars due to the safety of the cars and so forth. More drivers than ever on the road. The deaths have gone down every year for decades now, so it's been a great improvement. Those safety measures have helped. And yet our people are dying of unintended consequences. Opioids that we talk about, most of them are accidental. People don't intend to kill themselves. Men have a higher death rate than women do. The age group was surprising to me, 45 to 54 for drug overdose deaths. Suicides have increased, and certainly people with mental disorders have a higher incidence. And it now is pushing 30,000 people a year who die of unintended overdoses. I mean, it's just incredible. So I thank you all for being here. And what's also interesting is, and I'm interested in hearing what the DEA has to say, I don't know whether you all are going to speak or not, but if you look at the demographics of the country, for instance, Maine has 4 times as many deaths as South Dakota. It's very much a problem here in Appalachia. If you look at where the problems in Tennessee has a real problem. So we need to identify why and do something about it. I know as a doctor, and we were talking with the DEA agents before we got started, what would happen, and I've heard every cock and bull story in the world about somebody needing prescription drugs. And what would happen is that at 5 o'clock when the door closed in your office, the phone would ring. You didn't have access to your medical record. And so then you would get this story, and when you were in a large group, it would sound really good, but we stopped prescribing any unless you knew the patient that you had operated on after 5 o'clock. Now, we changed to an electronic medical record, and what would happen would be is that you would get the name of the patient. You said, well, Bob, what is your name? And you'd type it in, and you'd find out that they weren't a patient you practiced at all. They were just drug seeking. This goes on all over. They're very good at it. We have problems with these pill mills in Florida coming back up into here. We know that's an issue that law enforcement told me they're dealing with. So there are a lot of issues today. I thank you for being here, and I'm really interested in hearing what you have to say. Bill?
Our next speaker is Tommy Farmer, the director of the Tennessee Meth Task Force with the Tennessee Bureau of Investigation. Tommy.
Well, thank you very much, and Congressman, I appreciate you holding the event and inviting us all here to talk about it. You know, looking at I'm going to break them into 3. If we look first at the methamphetamine issues, our primary concern, our primary issue, yes, we have a meth problem. We've been aggressively dealing with it, and I would say that I would challenge any state across the country as to whether or not there's been another state that has aggressively went after this problem as we have, in terms of working very closely with our congressional delegates all across the state. You guys have been very good to us in establishing funding necessary to develop a program, what I would consider a state-of-the-art program, an innovative program. Our Meth Task Force program has been nationally recognized, and other states are looking at a similar model to deploy into their states. And the model works so well because we focus on, we're target specific, and we focus on a collaboration and working very closely with all of the partners that are out there. And I think if you find a bright side, if there is a good side to the meth scourge, it's been the fact that it's forced a lot of us to come out of our disciplines, to come out of our groups and what we do specifically, and we've had to come to the table with other groups. I see Chris Andell. Where are you at, Chris? Chris from TDAC, working very closely with the folks from the environment, social services, child protective services, state, local, federal law enforcement, working with our media to get the word and to get the message out, and of course counter-drug, our counter-drug folks, utilizing those resources that are out there and then bringing them together in a partnership and an alliance. So the good side to it is I think that we aggressively went after the problem, and I think that we've learned a lot from it. And honestly, I hate to say this, but I think that we're going to be better prepared for the future in terms of many of the things that you spoke of. One, dealing with prescription drug issues, and now the latest and the greatest thing that's coming down the pipe with all of these synthetic analogs. And I tell you, Mike Stanfield and I from DEA, we were sitting there talking about the synthetic analogs, and I'm going to tell you, we are from law enforcement, and if I'm saying something that you guys don't agree with, please let me know. We are very concerned with the synthetic analogs. We're concerned because we're somewhat accustomed to, because of methamphetamine, and dealing with a synthetically produced drug that is clandestinely manufactured or domestically manufactured in makeshift labs all across our state and all across our country. We've become pretty efficient at identifying those, training and equipping our law enforcement to go in and safely address them, dismantle them, and now we're much better off at transporting, packaging, and neutralizing and taking these out. And so when you look at clandestine production of any synthetic drug, you have ingredients that are going to transfer from one to the other. So all of these clandestine type drugs are going to have catalysts, reagents, solvents, organic solvents, acids. Those are type things that are necessary in any type of production. And when we talk about the analogs, folks don't realize this is not coming out of some professional business or some organization. It's not. These are coming out of makeshift labs. And so makeshift labs setting up in somebody's basement that are manufacturing these drugs. And even just the terminology that they're calling them, synthetic cannabinoids, aligning them with marijuana. It has nothing to do with marijuana. These are chemicals. These are chemicals that they're marketing. And then controlling them, we've got our work cut out for us. We really have our work cut out for us in terms of because it's a chemical, they can simply change the structure of it, the formula of it, just so slightly. And ever so slightly, and Mike can comment to it just a little bit more, but I think DEA has been working aggressively for the last 3 to 5 years, working on identifying 5 of the synthetic analogs, bath salts, incense. And you guys are working on regulating those with your help. And already we know there's 137 alternative formulas that are ready to be released or ready to go out. So that's a challenge for us. But again, looking forward, I think that, I hate to say it, I think that law enforcement as we know it, we are pretty much trying to embrace the change. It's definitely a new day. And our law enforcement, our public servants, are going to have, we must be prepared to protect our law enforcement, protect our first responders, protect our fire officers going into these scenes, and have the necessary protective equipment, and also have the necessary training and skills so that we can better protect the public out there. So, in terms of meth labs and the disposal, it's easy to get caught up in meth labs, and meth addiction itself is a significant problem. What is really draining our resources in the state of Tennessee and across this country are dealing with the meth labs, the labs themselves. The meth labs are what's creating so much waste, or creating the explosive and dangerous and toxic environments for the children to be in. And it's the totality of circumstances. It's everything that's involved with the clandestine manufacture of these drugs. And what makes it very complicated for us is the fact that common household ingredients. I mean, they're very common. Almost most of the ingredients can be found in someone's house already. So we know that's a challenge, but it's the cumulative impact that it has on our community. It absolutely drains our resources. We expend so much time and so much of our resources trying to combat and deal with the fallout or the impact from our burn care centers. I think there's been several stories of late in the press and the national media talking about burn care centers. If you simply look at the burn care centers alone, I think currently at Vanderbilt Burn Center, it's a regional burn care center in Nashville, 1/3 of the patients, 1/3 of the patients there at the burn care center are meth related. And with this method that they're using now, the criminals are using to manufacture meth, called the shake method. And I honestly believe the very first shake lab that we're aware of, Reagan Tilson there, the chief of Irwin, seized the very first shake lab in the state of Tennessee. Reagan, appreciate that. A long time ago. But since then, with this method, it's not a matter of the law of averages running up on you and you injuring yourself or having an accident in your meth lab. Now it's a matter of when. You're going to catch yourself on fire, this lab is going to explode, and there's going to be a problem, and there's going to be significant injuries that relate from those. But one example there at the Burn Care Center with Mark Buckner out of Athens, Tennessee, and I wish I could show you a video on this one that was captured on Nat Geo. But Mark Buckner is probably one of the most egregious examples of the impact that this drug has had on our community. Mark had his unfortunate accident, resulted in burns over 60% of his body. He was airlifted to Vanderbilt. He spent the next 5.5, 6 months of his life at Vanderbilt University. They did a fine job working to save his life, and they did that. They did save his life. The unfortunate problem is when Mark Buckner got out of jail, it took him about 2 weeks and 3 days, and he went back to manufacturing methamphetamine again. And our law enforcement had to respond back out, and we seized subsequently two more meth labs off of this Mark Buckner. Now the cost of Mark Buckner's stay at Vanderbilt was over $1 million to save his life. It's $1 million of uncompensated care. And in the same year, Vanderbilt, they absorbed over $300 million in indigent care. Granted, not all of that was off of meth-related patients, but when you factor in 1/3 of those patients and the cost of care for a burn patient versus the cost of care for an average patient in that hospital, it's going to be a significant portion of that. And this is not unique to Tennessee. It's all across the country. Now, what is unfortunate, the dubious distinction of Tennessee in 2010, we were not #1 in football, unfortunately. We were not #1 in basketball, unfortunately, boys or girls. Unfortunately, we did have the dubious distinction of being #1 in the nation for meth lab seizures. Now, not all of that is a bad thing. I think a good portion of that was due to our aggressive law enforcement. We've got some of the best in the nation. I think it's due to the fact that we really took, with our partnership, we've taken an aggressive stance and we went after the problem. But unfortunately, it's a dubious distinction that we have to live with. So we could go on and on with prescription drugs, no question about it. But we're on the 4th, 5th year of strained resources. And I think that unfortunately, we have really reached our limitations. And in terms of dealing with something else out there, we've got to get a grasp on the methamphetamine. We've got to get a better handle on pseudoephedrine. And if we can't stop those, and prevention is obviously the best tool that we would choose, then we've got to be able to work them more efficiently and effectively. If we can't prevent it, then we've got to be able to do a better job to address it. So we've got outside, the Command Sergeant Major Jim Derry has got the educational training. We've got some static displays that are just outside from our educational initiative. That's part of the task force. And then I've got a couple of the response truck drivers. Please disregard the dirty trucks. They were out on labs. I think they were assisting Sullivan County last night with some meth lab seizures. So those are working trucks and active trucks. And if you look at the front part, the truck itself is primarily, it has decontamination, processing equipment, assessment equipment, communications capability for our law enforcement to keep them safe. You might find a coffee pot in there as well. And in the back, the trailer that's attached to them, is the unit that where we neutralize and our law enforcement neutralize and dismantle, and then we will ultimately transport the lab components from the site to one of the containers that we have strategically placed throughout the state. So I'll be happy to take any questions after, and we can look at those containers. And Congressman, thank you very much for your support. I appreciate your efforts and what you do for us. And honestly, this is a scourge that impacts all of us. And it's not something that one of us can win together. But I think collectively, we work together. I think we can make a difference.
Thank you, Tommy. Our next